Pharmapal.
Optimizing PARP-1 inhibitors, computational drug design. Hey everyone! Welcome back to our channel. Today, we're diving into some exciting advancements in the field of medicinal chemistry, specifically focusing on a paper by P. Jean, titled Overview of Recent Strategic Advances in Medicinal Chemistry. This paper, published in the Journal of Medicinal Chemistry, explores innovative strategies that are shaping the future of drug discovery. So, let's break it down. First off, what is medicinal chemistry? Simply put, it's the discipline that combines chemistry and pharmacology to design and develop new drugs. Think of it as the bridge between science and medicine, where chemists work to create compounds that can treat diseases effectively. Key themes from the paper. Strategic advances. There are several strategic advances in medicinal chemistry, including structure-based drug design, SBDD. This approach uses the 3D structure of biological targets to design new drugs. Imagine having a blueprint of a lock and creating a key that fits perfectly. Molecular docking. This technique simulates how a drug interacts with its target. It's like testing how different keys fit into a lock before you actually make them. Utility functions in drug design. Another fascinating aspect discussed is the use of utility functions. These functions help researchers evaluate the desirability of potential drug candidates based on various parameters, such as potency and selectivity. For example, if a compound has a low IC50 value, indicating high potency, it scores higher in desirability. Conversely, compounds with undesirable off-target effects score lower. One of the key applications of these strategies is in developing PARP inhibitors, which are used in cancer treatment. The paper details how researchers are optimizing these inhibitors using a scoring scheme to prioritize compounds for further development. To assess the effectiveness of PARP inhibitors, researchers calculate a desirability score. This score is derived from various utility functions and helps in the lead optimization phase. The goal? To find compounds that not only work well but also have minimal side effects. Next, we'll explore the figures and tables that summarize key findings and methodologies in discovering PARP-1 inhibitors. So, let's get started. First up, we have utility functions. These are essential in assessing the desirability of PARP-1 inhibitors based on their potency. This means that if the IC50 value is less than 10 micromolar, the score is 0, indicating low desirability. Conversely, an IC50 above this threshold earns a score of 1, reflecting higher desirability. Next, let's look at Figure 6, which illustrates the scaffolds explored using structure-based drug design. This figure highlights A. Modifications of the olaparib scaffold. B. Changes to the veliparib scaffold. C. A comparison of both modified scaffolds. These modifications are crucial as they can significantly enhance the efficacy of the inhibitors. Moving on to Table 4, we see the different desirability scores calculated for various PARP-1 inhibitors. This table includes weighted desirability score, W score, average desirability score, averaged score, simple multiplicative desirability score, score. Each of these scores is derived from utility functions that assess parameters like potency and off-target effects. For instance, olaparib scores a perfect 1 across the board, indicating its strong performance as an inhibitor. Now, let's discuss molecular docking studies. These studies simulate the interaction between small molecules and biological targets. They help predict how well a potential PARP-1 inhibitor might bind to its target. The findings suggest that hydrophobic contacts, indicated by van der Waals energy, play a significant role in enhancing the potency of these inhibitors. Lastly, we explore the decision tree approach, DTI, used for retrospective assessments of PARP-1 inhibitors. This method evaluates the cumulative contributions of various parameters to ensure they remain below a certain threshold, guiding the progression of compounds through the discovery phases. In conclusion, the paper by P. Jean sheds light on the innovative strategies that are transforming medicinal chemistry. From structure-based drug design to the application of utility functions, these advances are paving the way for more effective and safer drugs. Thanks for joining us today. If you found this summary helpful, don't forget to like, subscribe, and hit that notification bell for more insights into the world of science and medicine. Until next time, keep exploring.
Pharmapal.